have a brief presentation. I'm not talking about the guidelines. I'll be speaking to the global technical strategy that sets the targets and goals for us for the next 15 years. Like I said earlier on, this was endorsed by the ministers at the World Health Assembly. Everyone contributed to it. And so I can safely say that we all have a collective responsibility and an agreement that this is the way that we should be going. Essentially, the strategic principles is that countries can accelerate efforts towards elimination. They are all moving towards elimination, but this can be accelerated, and we have a window of opportunity to accelerate things as quickly as possible. And very importantly, country ownership and leadership, which is key and crucial. And it has to be the country's plans that are being executed and not external plans. So country ownership, leadership, improved surveillance, monitoring and evaluation is key as we move forward. Equity in access has remained a challenge, but if we're going to move forward with the global technical strategy, some of the strategic principles, they have to be equity, services, especially to the most vulnerable and hard-to-reach populations. And I dare say some of the hard-to-reach populations we see in this part of the world are cross-border migrants, and that's a difficult population to reach because it goes beyond health. It's an issue of migration and recognition, and so these are critical areas that we need to look at. And innovation in tools and implementation approaches. We have tools presently. We need new tools, but we also need to enhance the tools that we are using currently. So all of these are some of the strategic principles around the global technical strategy. And the strategic framework, there are essentially three pillars. Ensure universal access to the interventions that we have currently. Accelerate efforts towards elimination. It can't be business as usual. Like I said earlier on, we have this window to accelerate on the gains that we have made up until now. And very importantly, to transform malaria surveillance into a core intervention. Over the years, one of the areas that have been least developed, one of the areas that has been least resourced has been surveillance when it comes to malaria programs. And we ran some years ago when we were looking at the investments from the Global Fund and country utilization, and realized that one part of the funds that were underutilized were funds meant for monitoring and evaluation. And also, when it comes to trying to find efficiencies and gains to move money towards buying commodities, one of the areas that suffers the most has to do with monitoring, evaluation, and surveillance. And except we strengthen and, as it were, transform malaria surveillance into a core intervention. It's not an intervention, but we need to look at it in the same context in the way we look at interventions. We are unlikely to achieve the goals that has been set in the global technical strategy. Of course, there are supporting elements, harnessing innovation and expanding research, both basic research, implementation research, actions for rapid uptake of tools that we have, modification of tools that we have for better efficiencies, strengthening the enabling environment, of course, a strong political commitment. And one of the things I would say here is, since the adoption of the global technical strategies, most of the regions have regional adaptation of these strategies, and even countries have started to build this into their strategic plans. So it's so important that we have strong political commitment and cross-border commitment across all sectors, multi-sectoral approach, capacity development, and health system strengthening. This capacity development is not just at the top level, and capacity development that has to go even as low down as possible to the community level. The communities have to be a part of this if we need to move things forward. The visions, the goals, the milestones, and the targets as laid out, it's broken down, the milestones is broken down in tranches of 5 years each. I dare say this is October 2017, so we are a few years away from the first milestone, which is 2020, and we should already begin to, because we we talk a lot about what has happened up to 2015, how things have moved between 2010 and 2015, but I think we should begin to look ahead now and begin to ask ourselves, how well are we positioned to measure ourselves against these milestones that have been set for 2020? Reduction of malaria mortality, reduction of malaria incidents, to eliminate malaria from countries in which malaria was transmitted in 2015, and of course to prevent re-establishment of malaria in all countries that are malaria-free. And the different milestones are set, and at least 40% for 2020, 2025, 75%, and at least 90% in 2030. Elimination is a continuum, and so because most times when we talk about elimination, we're looking at countries where the burden is low, countries in Southeast Asia, some few countries in Africa where they are moving, as it were, already in the elimination phase. But if we look at it from a malaria perspective, it's a continuum. Even countries like Nigeria, DRC, where they are not in elimination, we need to bring that burden down. They need to shift. And you are only as safe as your neighbor is malaria-free when it comes to the malaria ward. So it is important that we continue to focus also on reducing the burden of malaria in areas where malaria remains quite high presently. I just put this here to show that WHO, with the GTS, the Global Malaria Program, also redefines its targets and set goals against the GTS goals to measure itself and to, as it were, streamline the support that is given. The usual normative guidance, capacity development, surveillance, resistance monitoring, keeping an independent score, and strategic decisions, of course, streamlined, as it were, using the GTS targets as the goals to measure its achievements. Progress so far, I will not spend a lot of time here. The previous speakers have spoken to this and some of the slides, but in looking ahead, we need to see where we are so far. This is from the World Malaria Report 2016. The 2017 World Malaria Report is in the works, which will be released soon. And we know that we're making progress in terms of expansion since 2010. Progress towards GTS milestones of eliminating malaria from 10 countries or more looks attainable. However, there's a challenge with funding, which was highlighted earlier on, and I will speak to it shortly. Just to note that 51% of February children less than 5 years attending public health facilities received a malaria diagnostic test. This is a major achievement. This is especially in Sub-Saharan Africa, compared to 29% in 2010 to 2012, according to the surveys from 23 countries. Dr. Kisete spoke to this earlier on. And also in terms of case incidence, the reduction has been remarkable. The mortality reduction has been remarkable. And all of these, we're looking at the years between 2012, 2013, and 2015. However, there remains a big gap. A lot of cases, 212 million cases estimated in 2015, majority of it in Sub-Saharan Africa, the same to do with deaths. Majority of it in Sub-Saharan Africa, 70% of deaths are in children less than 5 years. So yes, we've made a lot of gains. We have the global technical strategy. There's still a lot of work to be done. Gaps in terms of coverage. The very first pillar is access to all. We still have problems with access. These are tools that we have presently. And just ensuring that those tools get to those who need it when they need it remains a challenge. I always want to remind us that, see, if I use the example of coverage with nets, long-lasting successor-treated nets, we talk about universal coverage. It's always very easy when you look at it for a country as a summary. Say, oh, well, the country achieved 80% coverage, universal coverage with nets this year. But when you deep down, you may find out that those campaigns are not done across the country at the same time. So looking at regional coverage within a country. And so there are large chunks of time in those countries when the coverage is not 100%. But when we average it at the end of the year, looks like as if it's universal coverage. So a lot more work needs to be done to ensure that the high-burden countries, and not just high-burden countries, the at-risk population, whether it's in the elimination phase or in the control phase, they have access to these interventions. There are challenges in moving forward. Resistance to the drugs, resistance to insecticides. Currently, the ACTs are still the drugs that we have in the immediate and near future. We hear MMV, this is their area where they try to come up with new products or make existing products more user-friendly and more adaptable for where it is needed. We have issues of infectious reservoirs, millions of cases that are undetected as they are asymptomatic, enhancing and pushing transmission. The issue of Vivax has been mentioned earlier on. Unlike falciparum, where using a single dose of primaquine, you can reduce transmission. But for Vivax, they tend to transmit before they develop clinical symptoms. So that's a challenge. Outdoor biting mosquitoes, residual transmission, it's a challenge. And these are areas we need tools. The private sector, we need to find ways to integrate and incorporate them into the overall health system and reporting system and ensure that they're doing the right things. Health systems, the extent to which we achieve our goals, essentially it's as strong as the health systems. Financial resources has remained a great threat as continued effort towards malaria is largely dependent on finances available. And I added the last one. These are challenges that are emerging, beginning to have zoonotic infections affecting humans. Added another challenge to the whole spectrum of malaria control and elimination. I think this is one of my last slides. This has been shown. The point I wanted to make with this is between 2009 and 2015, the funding have not changed essentially. And so if we say that we achieved all the goals, or all the gains we've spoken about, the reduction in morbidity, reduction in mortality between 2012 and 2015, with this amount of resources, then things need to change dramatically if we want to move from 2015 beyond and continue to show these gains. Because we're already beginning to see countries where there are reversals in gains, where there are upsurges in malaria cases, simply because the resources have dropped, both from the Global Fund and you're not having a lot of support as previously. So it's really a big challenge that malaria funding needs to change, the landscape needs to change if we intend to achieve the goals that we have set. What's happening in the near and medium term? There are innovations, vaccines, the large scale, the ROTS phase 4 trials are almost on its way now. Diagnostics, more sensitive diagnostics are out, a lot of discussions ongoing, and not just for malaria diagnostics. We have tools, diagnostics for things like GCSPD testing, things that are essential for us to have effective case management, new anti-malaria medicines, tafenoquine, we discussed. Vector control, we need new insecticides to address the challenges of insecticide resistance and tackling the challenges of residual transmission. So these are areas where a lot of work ongoing and things that will take us towards achieving the goals that has been set in the global technical strategy. So in conclusion, there have been much progress in expanding access to malaria intervention since 2010. More people have access to interventions, mosquito nets. More women receive preventable treatment, the IPTPs. More patients receive diagnostic tests and treatment with ACT. Prospects of attaining the GTS 2020 milestones in 3 years' time looks promising. Progress needs to be accelerated to achieve the 2020 milestones, reducing case incidence and mortality rates by 40%, especially in countries with high burden malaria. If global targets are to be met, funding, both domestic and international resources, must increase substantially. But recent experience shows that with robust funding, effective programs, and country leadership, much progress can be made, and the benefits will be very huge. Thank you very much.